The palatine bones are paired and intervene between the maxillae in front and the pterygoid processes of sphenoid behind. Each bone is L-shaped and consists of horizontal and perpendicular plates and three processes: orbital, sphenoidal and pyramidal. The first one, horizontal plate. It is quadrilateral in shape and presents two surfaces, nasal and palatine, and four borders: anterior, posterior, lateral and medial. The nasal surface is concave from side to side and forms the posterior part of the floor of nasal cavity. The palatine surface joins with its fellow and forms posterior 1/4 of hard palate. The anterior border articulates with the palatine process of maxilla. The posterior border is free and concave and presents medially a conical backward projection which with its fellow forms the posterior nasal spine. The expanded tendon of tensor veli palatini, or otherwise known as palatine aponeurosis, is attached along the posterior border and extends up to the palatine crest. The posterior nasal spine gives attachment to musculus uvulae. The lateral border is continuous with the perpendicular plate of palatine bone and marked by the lower end of the greater palatine groove. The medial border articulates with its fellow and forms a raised nasal crest which joins with the lower border of the vomer. The perpendicular plate. It is an oblong vertical plate and possesses two surfaces, nasal and maxillary, and four borders: anterior, posterior, superior and inferior. The nasal surface forms the lateral wall of nasal cavity just in front of the medial pterygoid plate. It is marked by two horizontal bony ridges, the conical crest below and the ethmoidal crest above. The conical crest articulates with the inferior nasal concha, and the area below it is depressed to form the lateral wall of the inferior meatus. The ethmoidal crest articulates with the middle nasal concha, and the depressed area between the ethmoidal and conical crests form the lateral wall of the middle meatus. Further above the ethmoidal crest there lies a narrow groove for superior meatus. The maxillary or lateral surface presents three parts: intermediate, postero-superior and antero-inferior. The immediate and major part articulates with the nasal surface of the body of the maxilla behind the maxillary hiatus and bears an oblique deep groove which with the similar groove of maxilla forms a bony canal for the transmission of greater palatine vessels and nerves. The postero-superior part is smooth and forms the medial wall of pterygopalatine fossa. The antero-inferior part is also smooth, which overlaps the posterior part of maxillary hiatus and forms the medial wall of the maxillary sinus. The anterior border projects forward in the lower part as the maxillary process overlaps the maxillary hiatus and articulates with the similar process of inferior nasal concha. The posterior border articulates with the medial pterygoid plate. It is continuous above with the sphenoid process and below with the pyramidal process of palatine bone. The superior border carries the orbital process in front and sphenoidal process behind, separated by the sphenopalatine notch. The latter is converted by the body of the sphenoid into a sphenopalatine foramen, which communicates the pterygopalatine fossa with the posterior part of superior meatus and transmits sphenopalatine vessels and posterior superior nasal nerves. The inferior border is continuous with the lateral border of the horizontal plate. The pyramidal process. It projects posterolaterally from the junction of the perpendicular and horizontal plates and articulates with the margins of pterygoid fissure between the two pterygoid plates. The pyramidal process presents posterior, lateral and inferior surfaces. The posterior surface forms a part of floor of pterygoid fossa and gives attachment to the medial pterygoid muscle. The lateral surface articulates in front with the maxillary tuberosity and the rest forms the medial wall of the infratemporal fossa. The inferior surface presents foramina for the lesser palatine vessels and nerves. The orbital process. It projects upward and laterally as an expanded process from the superior border of the perpendicular plate and in front of the sphenopalatine notch. It contains an air sinus and presents 5 surfaces, 3 articular and 2 non-articular. The articular surfaces are: number 1, maxillary, which is directed anterolaterally and joins with the body of maxilla. Number 2, ethmoidal, which is directed anteromedially and articulates with the labyrinth of ethmoid. Number 3, sphenoidal, directed posteromedially with an upward tilt and articulates with the sphenoidal concha. It usually bears an opening for the air sinus and communicates with the sphenoidal sinus. The non-articular surfaces are: number 1, orbital or superior surface, which is triangular and forms the most posterior part of the floor of the orbit. Number 2, lateral surface, forming the medial wall of pterygopalatine fossa, is separated from the orbital surface by a rounded border. The latter forms the medial part of lower border of the inferior orbital fissure. The sphenoidal process. It projects upward and medially from the superior border of perpendicular plate and behind the sphenopalatine notch. It presents 3 surfaces and 3 borders. The superior surface is articular and joins with the sphenoidal concha. Further behind, it carries a groove and is overlapped by the vaginal process of medial pterygoid to form the palatino-vaginal or pharyngeal canal, and the inframedial surface is concave and forms the roof and lateral wall of the nasal cavity. The lateral surface forms the medial wall of pterygopalatine fossa. The anterior border forms the sphenopalatine notch. The posterior border articulates with the vaginal process of medial pterygoid plate. The medial border articulates with the lateral margin of the ala of the vomer. These were the basic points regarding the palatine bone. Thank you for your patient listening.